So now we will continue with non-steroidal anti-inflammatory drugs, that is NSAIDs. So what are the pharmacological actions of NSAIDs or aspirin? First of all, we will take the most important pharmacological effect, and this is the anti-inflammatory effect. How it acts as an anti-inflammatory drug, that it inhibits prostaglandin synthesis at the periphery. So this results in inhibition of granulocytes, adherence to the damaged vasculature. It stabilizes the lysosomes, and also it inhibits migration of polymorphs and macrophages at the site of inflammation. And hence it interferes with chemical mediators of kallikrein system. This phenomena leads to suppression of all manifestations of inflammation. So all the manifestations, like we mentioned, when adherence to damaged vasculature of granulocytes, stability of the lysosomal membranes, inhibition of migration of WBCs and macrophages, and interference with the chemical mediators at kallikrein system. Analgesic effect. How analgesic effect is produced? NSAIDs are classified as mild to moderate analgesics. Bradykinins, histamines, cytokines, as I told you, TNF-alpha interleukins liberate prostaglandins after inflammation and tissue injury. This sensitizes the pain receptors to mechanical and chemical stimulation, and hence it decreases the threshold of nociceptors of C fibers. These C fibers mainly are concerned with pain sensations. So all type of pain sensations, they are reduced because of analgesic effect from these NSAIDs. NSAIDs basically produce analgesia, that is loss of pain sensations, by inhibition of prostaglandin synthesis. They relieve pain by peripheral action. However, there is a direct action on CNS that is also involved in pain relief. Antipyretic effect. Pyrexia is raised body temperature. Antipyretic means they act against the raised body temperature. You all know that hypothalamus regulates the body temperature and maintains the temperature at a set point. Fever after infection and tissue injury, it automatically leads to formation of cytokines like tissue necrotic factors and interleukins, which further increases the synthesis of prostaglandins, and this further triggers the hypothalamus to raise the body temperature. NSAIDs and aspirin suppress this response by inhibiting prostaglandin synthesis. They do not inhibit fever by directly administered prostaglandins, rather inhibit fever caused by agents that promote synthesis of interleukin-2 and other cytokines. Anti-platelet effect. Aspirin in very small doses, that is about 75 to 100 milligram, decreases platelet aggregation by suppressing the synthesis of thromboxane A2. And this 75 to 100 mg is very much effective in those patients who are having myocardial infarction or heart diseases. It also irreversibly acetylates COX, so the effect lasts for about 10 days till new platelets are regenerated. High doses suppress prostacyclins also, and platelet inhibitory effect is lost. Now, what is the effect on GIT? NSAIDs and aspirin produce anorexia, means loss of appetite, nausea, abdominal pain, diarrhea, gastric, intestinal ulcers due to. Now, what are the reasons? Actually, they inhibit COX-1 in GIT mucosa. This further depresses the formation of prostacyclins, that is PGI2, and prostaglandin PGE2. As we mentioned earlier, that these prostaglandins are very much helpful in making a cytoprotective covering within the mucosal lining of the stomach. Now, whenever they are inhibited, there will be raised mucus secretion, and this enhances the mucosal blood flow. And it can cause further acidity and rise of acidic secretions within the stomach. They also cause local irritation, which causes back diffusion of acid into gastric mucosa, and this can induce increased tissue damage. Also occurs more with aspirin because it irreversibly acetylates COX enzymes. Uricosuric effect. Uricosuric effect means increased excretion of uric acid. Low doses, that is 1 to 2 gram per day, decrease the urate excretion and elevates the plasma urate concentration. Definitely, you know all that whenever urate excretion will be decreased, so in the plasma the level will increase. So there is vice versa. In high doses, that is above 5 gram per day, it induces uricosuric, that is excretion of the uric acid through urine, and this lowers the plasma urate level. Intermediate doses, 2 to 3 gram per day, do not alter urate excretion. Effect on CVS. Low doses of aspirin, that is less than 100 mg daily, used for cardioprotective effect. This is more used in those patients who are having infarction, myocardial infarction, or certain vessel diseases. At high therapeutic doses, that is more than 3 gram daily, they can cause salt and water retention within the body, which increases circulating plasma volume. Peripheral vasodilatation due to direct effect on the vascular smooth muscles. What are the renal effects? NSAIDs have little effect on renal function in normal human subjects. COX inhibitors, however, prevent synthesis of PGE2 and PGI2, which are responsible for maintaining the renal blood flow, water, and salt excretion. However, if there are decreased synthesis of prostaglandins by NSAIDs, this can result in salt and water retention and may cause edema and hyperkalemia in some patients. What's the effect on respiration? At the therapeutic doses, salicylates, they increase oxygen consumption and carbon dioxide production as a result of uncoupling oxidative phosphorylation. This further increases the production of carbon dioxide, and this further stimulates respiration. Higher doses act directly on respiratory center, causing hyperventilation and respiratory alkalosis. That's why aspirin dose, it must be regulated, and we should administer a rational dose as and when required. Hepatic effects. High doses of salicylates cause reversible hepatic injury. That means if the dose is reduced or if we stop the drug, this injury can be reversed or can be treated. What are the metabolic effects? Metabolic effects, mainly the most important is the carbohydrate metabolism. Large doses of salicylates cause hyperglycemia, glycosuria, and deplete liver and muscle glycogen. They also have local irritant effects, like salicylic acid. If it is applied to the skin, it is irritant to the skin and mucosa because it destroys the epithelial cells. This action is used for the treatment of warts, corns, fungal infections, and eczematous dermatitis. Methyl salicylate, however, it is used as a counter-irritant. That means it can reverse the irritant effects. Now, what salicylates do in pregnancy? Long period use of salicylates during pregnancy can result in delivery of low birth weight babies. So this is one of the adverse effects. When given during third trimester, there is increased perinatal mortality rate. Anemia can happen, antepartum and postpartum hemorrhages can occur, prolonged gestation, premature closure of ductus arteriosus, and complicated deliveries can occur. So all these adverse effects, they can happen within a pregnant lady as well as fetus is affected after the birth. Thank you for your listening and your attention.